Chiropractic Center, Dr. Randy Penn. Good morning.
Good morning.
Good to see you.
Andy. Good to see you, Jennifer. Thanks for having me.
Of course.
Sure.
Yes. Of course. So, you know, with the weather changing, I'm feeling things that I haven't felt.
Yeah.
Is that normal?
Well, no doubt. This region is very tough on our bodies.
Yeah.
There's no question. As the seasons change, especially as we age, right?
Yeah.
Do you see him look right at me when he said
I
that?
did see that. I noticed. You looked quickly at Jennifer and then looked back at me and then looked back at Jennifer.
As you're aging. Move on.
Yes. So it is. The region is tough on the body.
Yeah.
So our whole focus is certainly getting people in a state so that they can move better, feel better, think better, overall sense of well-being. That's our whole purpose, really.
Great. So if somebody is new to chiropractic, what can you tell our viewers to help kind of walk them through the process?
So it's a great question. I mean, chiropractic is kind of like the best kept health secret that we know of, really, because it's underutilized still, even today. So first step is our whole purpose is really to educate the community and then adjust really as many families as possible towards optimal health. Our clinic doesn't just focus on symptom relief, but rather really overall well-being and optimal performance. That's where our sports programs kind of come in, is really enhancing the body's ability to perform at its highest potential. So in our world, we don't just chase the pain. We don't just, if someone comes in with neck pain, we don't just check that area, we check their whole nerve system. And that's kind of, I feel what separates us a bit is it's not just a pain relief clinic, it's more of an optimal performance program.
So other than adjustments and things that are normally associated with chiropractic, you have some technology. I'm a huge fan of the laser.
Right.
But you have technology that does when you have an injury or something that just needs some extra help healing. Can you tell us a little bit about some of that tech that you have at Penn Chiropractic?
Yes, it's. I think I studied it for about 10 years before we ended up getting the deep tissue laser, and then we also have pulsed electromagnetic fields, and those are technologies that help us really kind of reinvigorate the cells. So it helps us pull out inflammation and put energy back into the tissue. So how I got involved in it is it's really in most of the pro and Olympic training facilities.
Okay.
So any injury, tears, sprains, even fracture, concussions, things of that nature, we can get the cells to kind of revitalize by shining a light over the tissue. So in the case of the laser, the light get absorbed into the cells, and if everybody remembers the mitochondria from Bio 101 or whatever it is, that's like the powerhouse of the cell, right?
Yep.
So the light is absorbing from the mitochondria. The mitochondria absorbs the light, and that creates more energy.
Okay.
And creates more ATP, which is basically energy for the cells. So we can take tissue that has been damaged, sprains, strains, traumas, and where there's inflammation, wherever there's blood, we can help increase microcirculation and pull that inflammation out. So without drugs, without surgery, we've been able to help thousands of people really get through those challenges and revitalize their tissue.
Have you ever done the laser?
I have seen it in action, but I've never done it. Yeah.
I've had a couple of injuries that when I thought, this is it. I'm never going to be able to do anything ever again. And you go in and it's amazing what the combination of care that you have can do for people.
Now, Doc, chiropractic care is, it's a big part of professional sports, college sports, even high school sports. As a parent, actually, Jen, you're in this category too, parent of tweens, we'll call them. When's a good time to seek chiropractic care? Both kids are athletes. You're not sure if they need it or not. What's the best way, or timing-wise, for a young athlete to come see you?
It's a great question. We always focus on being proactive, right? So we don't really want to wait till injuries happen necessarily, although if they're injured at all, if they have any traumas, that's certainly a time to get them checked. But prevention is really the key. So we start checking infants from day one.
Really?
They start walking. What are kids doing when they're learning to walk?
Falling.
Yeah, they're falling. Maybe a couple hundred, maybe 1,000 times, right?
Yeah.
Before they really get it right, before they are upright. Well, those little jars, those little mishaps, childhood mishaps, can lead to imbalance, right? And coordination issues and things like that. So the idea is getting the brain connecting to the body right from day one. So
well, even birth itself
right.
can be so traumatic on the poor little baby. So do you do infant care?
Yeah, right from day one. So we take pregnancies all the way through, and that helps the fetus develop, and it helps. Our pregnancies tend to go much better and less time in labor and less stress on the baby coming through. So, but trauma does happen at birth. That's why we check then. When they're learning to walk again, youth sports, those soccer injuries, right when they start, those little traumas. In fact, the vast majority of adult health issues are childhood mishaps.
Really?
Oh, no kidding.
That went undetected and uncorrected.
Okay.
Yeah, youth sports is interesting too because you're constantly, we want to get our kids in as many things as possible. We're probably not stretching before and after properly, and that's just the way it goes. So as a parent, you really don't know, kind of how your child feels. Maybe they can't give you an accurate statement when they're practicing 4 nights a week. Maybe they don't know how they're supposed to feel.
Yeah.
Right, and that's the other thing is that we don't know what we don't know, and kids aren't complaining of a lot of pain. I mean, they're just going full tilt, right? And so those things can, we might not really know, they might not be complaining of pain, but what we can do is we can watch them move, and they may have a foot that's pronating more than the other, and that can affect their whole kinetic chain. They might then develop a knee problem, or they may be susceptible to a knee issue if they have a foot issue. So they're not complaining of back pain, but we can watch their gait, we can watch their movement. That's one of a big part of our study and our analysis is really how are they moving, right? What is their posture like? What is their head position like? And so it's kind of a big picture. It's not just focusing on joint pain, it's focusing on optimal nerve flow. And it all starts really from the brain.
I know you work with a lot of golfers. How's your golf game in particular?
Oh, that's a great question. It's been up and down. Up and down on the way up.
Not for lack of effort.
On the way up.
Not for lack of effort, though.
Right. No, we're trying.
Yeah. Well, hey,
just didn't get enough practice this year.
I'd be remiss. My mom is watching.
Oh, yes.
And Lucy is a huge fan of Dr. Penn's, and she suffered an injury recently, and it's been a long road, and you are bringing her back to life. So I thank you for that.
Thank you, and thank you guys for having
Including
us.
calling and checking on her on a Friday when you didn't have office hours, seeing her over the weekend, just obviously very vested in your patients.
Oh, thank you. Well, that's what we're there for, no question.
Dr. Penn, great to see you this morning.
Great to see you, Andy. Thanks for having us, Jennifer. Appreciate it, guys.
Dr. Penn from Penn Chiropractic Center.